Yeah, that's perfect. So we'll suppose Greg just had his ACL reconstructed in surgery, and so we're going to talk about some basic phase 1 exercises. So these are things that your physical therapist will have you do for the first couple months after surgery. And so right now he's doing what we call a quad set, and he's just flexing those muscles on the front of his thigh, called his quadriceps. And you can see as he flexes them, you can see his muscles contract, and he's pressing his knee down into the table, forcing his knee to go very straight. And that's often quite challenging. It's a very simple exercise if you haven't torn your ACL, but after surgery that can be quite challenging. And those muscles that you can see flexing tend to kind of go to sleep, and you're trying to wake them up here by flexing and doing those quad sets.
All right.
So the next exercise is called a heel slide, and it's obviously easy for Greg because he hasn't had surgery, but if you've had surgery, you're going to have lost some of this motion. And if you've torn your meniscus with your ACL, your surgeon may tell you not to bend your knee too far, so just be aware of that. But if you're okay to bend your knee, then your surgeon will probably clear you to take your knee brace off and start doing some of these heel slides. So the goal of this is to engage your hamstrings and also to train your knee to start bending, because it's probably not going to want to bend as far as it normally does after surgery.
So you want to go as deep as you feel comfortable without hurting it.
Yeah, and in the initial phases of after surgery, you may only be bending your knee like this far. It might be as far as you can go initially, and someone may actually have to guide you like this.
Okay.
But as you get stronger, a few weeks into it, you want to get to the point where you can pull the heel all the way into your bottom.
Do it by yourself.
Yes, And you can also, like, the first week or two after surgery, you can put like a strap or a big towel around your ankle and kind of use this towel to give yourself a boost.
Mm-hmm. Yeah.
The next exercise is called a straight leg raise, and just like it sounds, so we'll suppose, why don't we have you bend your right knee? We'll suppose he had surgery on this knee. So what he wants to do is keep his knee nice and straight, and he's just going to lift that leg up and down. And the key on this one is try to keep your knee locked out as straight as you can. And after ACL surgery, it is really difficult to do that. Your knee's going to want to bend a little bit. And a lot of people for the first 2 or 3 weeks don't even have the strength in their hip to do this. So what you can do is you can either
shorter ones like this.
Yeah, or you can have someone give you a little boost with their hand.
Yeah.
Or you can put like a strap or a belt around your foot and give yourself a little boost with your hands. But this is one of the phase 1 exercises where we want to see you do about 20 of these with a good lockout straight knee before we can safely advance to more, weight-bearing, more functional exercises. So those are 3 very good phase 1 exercises after an ACL reconstruction surgery.
And you mentioned that first one, it was hamstring, what was it again?
Quad sets.
The quad sets. You were saying that one is one that you can do prior to a surgery, right? Or not?
Yes, and your surgeon and your physical therapist will probably tell you all of these phase 1 exercises can actually be done prior to surgery.
But consult with them before you do it, right?
Yeah. The quad set though, that's something that you should be doing right after the injury, right after the surgery, and right after the surgery. There's really no time that you can't do that one.
Okay.
Because your knee's not really moving, you're just flexing your quads and trying to keep them awake and activated.
Keeping them from atrophy.
Yes. Yeah. So for this next phase 1 exercise, Greg is just doing some weight shifting. And so you might do this like in front of your kitchen counter or put your hands on the back of a sturdy chair if you're unstable. But you want to try and just shift your weights onto the side that you had surgery and try to keep your knee locked nice and straight and stable as you shift your weight onto it. So this is a precursor exercise to getting to walk again.
Yeah, because it's the same motion when you're running or walking, and you feel the same muscles engaging, right?
Yeah. And a lot of times what will happen if you try doing this like the day after or 2 days after surgery, you'll shift your weight onto that surgical side and your knee will want to just buckle on you, like it just won't support your weight.
Yeah.
Or it might just be too painful. So you can start with your hands on the kitchen counter and just go real slow and gentle, but eventually you want to get to the point where you can put all your weight on that surgical side. So that will help you to wean off the crutches more quickly.
Nice.